Let me tell you, baby, you're not.
Hello, welcome to the Healthy Pet Show. I'm Dr. Paige Wages, and today we have Dr. Jeff Smith with us. Thank you for coming.
Thanks for having me.
All right. So Dr. Smith is new at our practice. He's been, well, not that new, I guess since February, right? He's been with us since February. He's here to share his knowledge about senior pets today. But before we get into that, just wanted to remind you, if you have any questions about your pets at home, to please give us a call, or any questions, anything at all, 919-996-6775. We'd be happy to answer any questions you have. Again, the number is 996-6775, and you can call in and ask anything about any of your questions. We are going to talk about senior pets tonight, but if you have any other questions about any of your pets at home, dogs, cats, maybe some rabbits, chickens and pigs, we can try. We'll try and answer those for you, okay? So Dr. Smith, we're discussing sort of, what do you think the most important thing for somebody who has an older dog, let's start with dogs, to do for care for their senior pet?
One of the most important things is just observing them for changes in their behavior, because pain is difficult to assess in the older pets. They're usually aging athletes with wear and tear and arthritis, so if they're not as mobile as normal, jumping up, those types of things, they may have some pain that's going unnoticed.
It seems like the bigger dogs, the large breed dogs like the retrievers and the Danes, seem to get a little bit stiffer, or easier. Maybe it's easier to notice because they're a little bit slower to get up off the floor, or a little bit, or when they go to sit down, they just kind of sit, kind of give up halfway down and just plop. Are those kind of signs of arthritis? Is that what you're talking about?
Yep.
Okay.
Just less mobility. Yeah.
Is there any other signs of that?
Obviously lameness. If I play fetch every day for several years and all of a sudden there's reluctance to bring that ball back to you, please don't throw it again, that hurts when I chase it down.
Yeah.
But yeah, if there's any lameness carrying a leg, obviously any whimpering, whining, it's maybe a little overboard for the senior dog.
Yeah, that's true. That's true. And I guess one other thought would be, for the older dogs, especially the really athletic ones, is starting them on glucosamine early on. Glucosamine is a supplement that helps to build up joint fluid, and it helps lubricate those joints so that it seems to delay the onset of arthritis. So really, really active dogs or larger breed dogs, or anybody that may have any joint issues, starting them on the glucosamine early on might actually help prolong the onset of those signs.
Yep, absolutely. There's some combination with fish oil, omega-3 fatty acids is a good joint supplement also.
Right.
Good.
Okay, so we have our geriatric dogs, and I love old dogs, so I like to talk about them. So we have looking for lameness or kind of stiffness, getting up and down. What are other things that people should be watching for?
I'm a tough guy on teeth. I think I feel like one of the biggest, single biggest things we can do is stay on top of that dental disease, the tartar buildup. People, we talk about cleaning teeth and people think it's brushing, and it's definitely more than that. But again, it's a source of pain for them, but that infection just simmers along day after day, year after year, and it can take its toll on vital organs. We get into heart conditions, heart murmurs, kidney conditions, kidney failure. So that's one of the big things, as we focus on that annual exam is really important, just to monitor these things and help people determine, what changes might be affecting the older animals. But the dental health is a big one, for sure.
So what are some signs of a dog that may be having issues with their teeth?
Certainly reluctance to chew hard toys, any type of harder bones, synthetic type bones, even raw hides, dry food. Dogs will prefer soft food or canned food to dry food. They can certainly have some dental pain. Or if they're having a chew and they have a sudden pain, they may drop something out of their mouth, that type of thing.
Yeah, I talked to an owner this morning actually, and their dog, they've noticed that it's just eating the dry food whole instead of chewing it. They've just been swallowing it, and they wanted to know if that was a problem, and thinking, might want to look in the mouth just to make sure the teeth are okay, or that something hasn't changed or different there.
Right.
I mean, some dogs just like to inhale it whole anyway, but just was thinking that might be something good to look at. But so dental pain, infections, if the tartar sits for too long, can cause issues, and those that, like you said, that bacteria could shower into the kidneys or the heart and cause problems either early on or especially as they get older, because just like people, dogs get immunocompromised as they get older. So their immune system is not as strong and can't fight off those infections as easy.
Yeah, sure.
So that would be a good thing. Dental disease, that's good. What else? What about what other things on the head could go wrong as they get older? Things to look for.
Certainly, in pets, we call it a little bit of dementia. What we call cognitive dysfunction. We'll see sometimes. So pets potentially losing their way, getting a little disoriented. Ultimately, standing in a corner, staring in a corner. We hear that often. But so we can see those, and again, back to the fish oils, essential fatty acids. If we have a prescription diet to help provide a little more nutrition for those brain cells, fatty acids go a long way with that cognitive dysfunction, if you will.
Yep. And some other signs of that are like waking up in the middle of the night or not sleeping through the night. Because just like people, I think their timetables get flopped. Or they sleep during the day so they're not tired at night, that kind of thing.
A little restlessness at night. Sure. Talk a little bit about heart conditions, which we can talk about, probably should. But heart conditions like to show up at night too, so we'll get a little restlessness, anxiety at night. And sleep can wake them up. But I mentioned the dental disease causing the heart disease. But if we get a heart condition, we may be monitoring it over time, but as it progresses to potentially congestive heart failure, pet might have trouble breathing, so excessive panting, even in the air conditioning, not after a walk. Obviously, the hot, humid days will really stress that heart condition. When we get around to spring and heat and humidity, the heart conditions can show up. That's something that can show up in the senior animal as those things progress. So obviously coughing, but coughing, excessive panting, exercise intolerance. The dog's dragging on the leash behind, going around the block. The exercise intolerance, things to look for a heart condition is another big one.
Right, exactly. Exactly. I can't tell you how many times we see pets that come in that the owners say, I used to like to play ball, but we'll only go for 2 throws and then lays down. Or we try and go for a walk and, they get halfway and then turn around and want to go home. So those are some signs of exercise intolerance and things to look for. And usually I'll just tell you, one of the ways that I tell owners that have heart disease that they can monitor at home is to count a resting respiratory rate. So when the pet is sleeping or resting, just kind of keeping tabs of how many times they breathe per minute, and just doing that periodically. And you can watch to see if the numbers are increasing, then something's changed or different. If they're about the same or somewhere close to about the same, then we're currently stable. So that is one way to sort of catch stuff before it becomes more of a problem. Or if the cough increases, you shouldn't cough at all. But if you have a little bit of a cough and that frequency increases or the intensity increases, then we probably need to see them. So
the changes are important.
Right. Yeah. Absolutely. I mean, the part of it is with the big picture with monitoring senior pets or owning senior pets is a lot of times there's such subtle changes as they get older. You see them every day.
Day to day.
So you don't see that they have lost 10 pounds or that they're they're not eating as well. Just there's little things that'll change. So just kind of keeping an eye on those things or bringing them in for an exam a couple times a year just as a check to make sure, because they do age pretty quickly. I know there's an old wives' tale sort of that they age 7 years for every one of ours. I'm pretty convinced that after age 10, it's like 10 years because their bodies just seem to age a lot faster suddenly.
Right.
So
It's not linear.
it's not. It's not.
Makes for easy math.
I
but
know. All right. What about? And this happens with people as you get older. What about eyeballs?
Certainly something to be aware of, and it's interesting on exam how we'll notice blindness on an exam and people don't even know, so the pets will compensate with smell, hearing, just tactile, so they just kind of have the house mapped out to where they can navigate
don't move
well.
your furniture.
If you move the furniture and they're bumping into it, there you have it. But it's pretty amazing. But so we'll see ocular changes just like in people. Couple of folks with glasses here, but
Wait a minute. You call yourself old?
That's right. You're not old yet. Okay. I speak for myself. Okay. But anyway, so age-related changes. So we'll see, some thickening and some opacity in that lens. Sometimes in the cornea with the buggy eye dogs. They have the constant abrasions on that globe or cornea. So we'll see changes there, potentially cataracts. Will decrease vision sometimes acutely.
Yep.
But
We're going to come back to the cataracts because we have to talk about cataracts because that's really common. But we do have a call. We'll go ahead and take that. Hello, you're on the Healthy Pet Show.
Hey, I'm a long-time viewer. I have a dilemma.
Okay.
I have a 71-pound hound dog. Has a big long tail that likes to get wagged, and he's kind of gnawed on the end of it. And I just noticed around my house, about 1.5 feet off the floor, there's all these red blood splatters all over the walls of my house, furniture. And how can I get this end of his tail to heal so this doesn't repeat and go on and on?
Yeah, so it's called happy tail, unfortunately, because they're so happy that they bang their tails on things and it can split the skin. Okay. And it is tricky to heal because they continue to whack it on things because they're happy. So I would have your veterinarian take a peek at the tail. A lot of times if they're open, they can get a little bit of an infection on there. So some dogs need to be on antibiotics for that. There is a way that you can pad the tail with kind of that pipe foam stuff. To keep it and to see if that helps to help basically pad it so that it gives it a chance to heal. Laser therapy does seem to help those heal as well, but some dogs it doesn't ever heal.
Well, we've been about every few days dipping our dog's tail in a cup of hydrogen peroxide.
Okay, well that's probably helped some. You don't want to keep it moist too much. It needs to stay dry so that it will scab.
Okay.
Okay, and then we just need to keep it padded some way, shape, or form.
Well, I'm going to give that a try.
Okay.
And I'll call back and let you know how it goes.
You have to let me know, because if it doesn't work, a lot of dogs end up losing their tail.
Oh, gosh.
And it just becomes a short little nub that can't be an issue, but some of them get so badly infected that we do have to cut the tail off.
Oh, gosh. Okay. Well, I guess I'll go talk to my vet, and thanks so much for your time, and I appreciate your show.
Thank you for calling the Healthy Pet Show.
Thank you. Bye-bye.
Yeah, bye.
Thank you.
That is a very common problem. I feel like mostly in labs, because they have the bigger thick tails, the crazy tails, but sometimes hound dogs have those big long tails. Greyhounds.
Greyhounds.
I've seen it in greyhounds.
Great Danes, potentially.
Yeah.
Not much fur
They
covering.
get real happy and then they wag their tails on things. It's just not a good thing.
Thump, thump. They're aspiring artists with their blood.
It is. It's terrible.
It makes quite a mess.
It is. It's terrible, and it is really hard to get them to heal. I can't. I've tried to save a lot of tails. Tried. Some of them it worked, and some of them it didn't. So, we have another call. Let's see.
Fun.
Hello, you're on the Healthy Pet Show.
Hi, I have a question about my senior pet.
Okay.
My dog Buddy is 10 years old, and I've noticed that he's losing weight, and he's just not really eating much. He just doesn't seem to know where he is sometimes.
Okay. So he's 10 years old. What kind of dog is he?
He's just a big mutt.
A big mutt. Okay. So we have a 10-year-old, and he's been losing weight, not eating as well. And he's getting lost. So there's a lot of things that can go on and change as pets get older. Usually we get worried that if they're not eating well and they're losing weight, that there could be something bad somewhere. They can get cancer, especially up in the liver or spleen area, that can affect their appetite. We always get worried with weight loss in dogs as they get older, because just like in people, cancer eats away at their body. So looking for that would be a good idea. So I would talk to your vet or go have an exam done, because the exams, sometimes we can find stuff on exam, but looking at getting some blood work and maybe an ultrasound done.
An ultrasound, okay.
Yep, because ultrasounds will help screen for things. In terms of, kind of getting lost periodically, that can be, like we were talking about, can be a little bit of senilism, which happens as they get older. The other things that can happen, and the only way to really tell 100% is an MRI, is they can get brain tumors, which can cause them to act weird. Their behaviors will change suddenly or kind of progressively, depending on how quick it's growing. And then eventually some of those dogs will start having seizures and things. But again, an MRI is the only way to really tell for sure, other than clinical signs. So I would sort of start, if it was me, I would sort of start with just kind of an exam and a baseline blood work and an ultrasound, just to see if we see anything.
Okay.
And then if everything's clear, we can sort of just play it by ear, and get the teeth checked if we're not eating as well, because they can get dental disease as they get older.
You might have a cracked tooth or something.
Exactly. And sometimes we can't see all the way back unless they're sedated, so it just kind of depends on what you would see with the exam to start.
Okay, thank you. I'll definitely bring them into my vet.
Perfect. Thanks for calling the Healthy Pet Show.
Thank you for your help.
Alrighty.
Bye.
Bye. Another common question. That was a good one. Yeah, so a lot of times so we tile, and then with the older dogs, they do lose weight. Some people don't notice it, some people do notice it. The bigger dogs, I think it's a lot harder to see unless they get really thin, right? And the littler dogs, a lot of people will notice a little bit more because their bones stick out a lot faster. Because for those little guys, a pound is a lot. Good questions. And just a reminder, if you have any questions about your pets at home, to call 996-6775. And we were talking about cataracts. And cataracts are common in both dogs and cats as they get older. What is it, when you look at an eyeball, for me as a pet owner, if I was looking at my eyeballs of my pets, how would I know if they were starting to get cataracts?
Well, it's difficult to tell actually without an ophthalmoscope. And obviously they can't tell us if they can see or not unless they're bumping into things. But obviously if the eye gets cloudy, people see that cloudy appearance. Can either just be, again, from those age-related changes, a little bit of opacity, called nuclear or lenticular sclerosis, just thickening of those fibers. And that's if people see us doing our exam, or even a human ophthalmologist will look through the lens and the cornea, so cornea, lens, back to the retina. And as I describe it, if I can see in, they can see out.
Right.
And when we talk about a cataract or an opacity in the lens, it'll have a similar cloudy appearance, sometimes more opaque, but we can't see through. I mean, varying degrees as it matures, but we can't see through to that retina. They can't see out, and so we head down that road towards blindness.
Right. Yeah, most of the time, if they're just starting to get cataracts, they'll hesitate going down. So like jumping out of the car or walking down the stairs, they'll get to the last 4 stairs and then they think they're at the bottom because the ground looks a lot closer than it is, so they'll do a flying leap. So just being aware that if your pet is developing, especially dogs, if they are developing cataracts, jumping off of things or going down might be a little bit scary for them. And they may hesitate, so just be prepared for that. And as the cataracts progress, you may want to block off the stairs so they don't take that flying leap, because they do injure themselves.
Good call.
Sometimes.
We get that call.
Yeah. Yep. So, all right, and then what about, so we did head sort of, and then belly. What kinds of things in the belly, like do they change shapes? I mean, I've seen, some older dogs, like mine, I had a dog with kidney failure, and his hair coat got a little bit thinner, and he seemed to have a little more of a pot belly that I could rub.
Right. there's quite a few things that can go on in the abdomen or changes, whether it's a hormonal fluid balance involving the kidneys. The liver can enlarge and cause that sort of distended abdomen, if you will. Obviously, cancers, we don't like to leap right to cancer, but as we do our exam, if we feel something abnormal, then we start imaging, radiographs, ultrasound, you mentioned. Is this something that's surgical or not? And we take that into consideration with the pet's age and other conditions going on. So that's what you mentioned before. Really starts with the exam.
Right. So
see
basically,
where
for our senior dogs, we're recommending having at least 2 exams a year, maybe more if they have things changing quickly. And then blood work, I do recommend it twice a year after they're 10. And then possibly doing an imaging of some sort, depending on what's going on. X-rays and ultrasound once or twice a year would be good. And you can, chest X-rays will screen for heart disease, lung changes, and then a belly ultrasound and belly X-rays to kind of look to make sure everything is still the right size, shape, and color. So that something's not changing. Because a lot of times if we can catch it's something we can catch early, then we can do something about it, and that might help prolong that pet's life. So, just thinking. All right, so we did dogs. We need to talk about pussycats before we run out of time, because I love those. I love cats. All right, so kitty cats, as they get older, pretty much get the similar things. A cat is not a small dog, but they can get arthritis, and they're harder to tell if they're getting arthritis. Most cats.
Are tough.
Cats are tough. They're tough because they hide their pain. So most common signs of cats with arthritis would be, they sleep more, they don't jump up on things as easily or as much. Very rarely will they walk around gingerly. Those cats are really painful if they are. But like my cats, he's getting up there and he's stopped jumping around as much. So I have recently just put him on a glucosamine, and that seems to have helped a lot actually. So that would be an option. Right,
and we see from that landing a lot of elbow issues in cats. Saw one today, but so we'll start with radiographs to kind of track down the lameness. Unfortunately, they don't tolerate our pain meds, anti-inflammatories that the dogs do, just GI and liver, kidney upset from those. So it's harder to have them on a daily dose of something for year after year like the dogs. So the joint supplement is key. They definitely tolerate and respond to the joint supplement in a lot of cases. So start that at any signs of lameness, reluctance to jump. They'll hide potentially. Cats hide. When cats hiding, it could be anything, but certainly pain, joint pain, abdominal pain, other discomforts. But so we have the joints, arthritis in cats, all of us, wear and tear. Some of the mentation issues that we talked about. We'll see.
Some of them will walk around at night and wow. Why do they do that?
Squawking, it's interesting. I've seen some correlation with the progression in kidney issues. I don't know if you've seen that, but when we do get
it's more because they're deaf. My old cat used to do that, and I'm pretty sure it's because she couldn't hear herself anymore. So she walked around and screamed for a while, and then she gave up. But I think she was trying to hear herself.
They'll do that or call to their people.
Whatever.
Their squawk out loud. But
it gets quiet at night. Yep. Things aren't moving, so maybe it's a vision thing too. Checking in. It would be good to have them checked if they're squawking at night. How's that? Because it could be a lot of different things.
Yeah, and a primary that can affect other things. We didn't talk about thyroid disease in older dogs. Typically, dogs will lose their thyroid function and become hypothyroid, so we'll see signs associated with that decreased housekeeping functions and metabolism from low thyroid.
They get fat.
in cats will develop a nodule that secretes too much thyroid or hyperthyroid, and they get skinny.
Right.
Even with a good appetite, those cats will jump on your plate after your chicken. They'll just get a ravenous appetite. So, and despite eating well, they get skinny. And so, I guess I've seen some of the squawking at night with the restlessness of
right.
hyperthyroidism.
Right.
So that kind of rolls in there. That hyperthyroid state is hard on the heart, hard on the kidneys. So then we can see the same issues of kidney issues or heart issues show up with an underlying thyroid. So that gets a little more complicated. That's our job to figure that out. But,
Right. I have to say, like the most common, because we're starting to run out of time a little bit, most common things that happen to cats as they get older is kidney disease, because they're carnivores, so they eat a higher protein diet because their body needs it. But over time, those kidneys just can't filter that protein. So monitoring blood work every year, and then twice a year after they're 10, to watch those kidneys. And same with the thyroid, is that I'll check that too. So, you know, the biggest things we see is hyperthyroidism, renal disease, sometimes diabetes, and then cancer. Those are kind of the big four for cats as they get older. And then blood work helps to monitor those. Ultrasound, if they're vomiting, and I learned this not recently, but at a talk, it was sort of, cats vomit all the, people think that's normal, but if the vomiting frequency increases, or they're vomiting more than once a week, there may be something going on, like irritable bowel disease, or they can get kind of a low-level cancer without the GI tract. So if your cat is vomiting, it would be something good to get checked out.
Right. I think a cat that vomits regularly and at a normal interval is one thing, but a cat that hasn't vomited for 7 years that you've had them all of a sudden starts vomiting, it can be food sensitivity. We roll into food allergy, inflammatory bowel, and that constant simmering inflammation. Obviously, we see more cancer if it is left unattended to. But,
right.
It's part of the,
sometimes it's just a change of diet.
Right.
Yep. Yeah, my older cat has just started having issues with hairballs. After a long time.
After all these years.
I know. Well, it's fine. That's fine. He's getting old. Maybe his little digestive tract isn't working as well, so he's on the hairball stuff and doing better, but that's just how it goes. So he is doing better. So, you know, the big thing with the senior, especially, and kitty cats can get heart disease, and there is a new blood test that actually tests to see if they have extra stretch on the heart for both dogs and cats. So that is something I would recommend having done at least once a year. Because that can catch heart disease before it becomes a major issue. Because 50% of cats with heart disease don't have a murmur, and 50% of murmurs in cats aren't disease. So it is hard to sort of tell apart. So having an exam done twice a year, blood work, ultrasound if needed, should be pretty good at monitoring those guys and taking care of them and loving them. So again, I wanted to thank you for watching the Healthy Pet Show tonight. Thank you, Dr. Smith, for joining us this evening.
Thank you.
And we look forward to seeing you next time here on the Healthy Pet Show.
Small ones, short ones, and tall ones.